of the human anatomy series. And since I have been getting comments from the students all over India that, sir, please do post videos about the anatomy, particularly the topic what they want me to discuss is about the circle of Willis. So students, today's topic will be mainly emphasizing upon the circle of Willis, and I have tried my level best with the help of a schematic diagram to explain to you guys about the arterial supply, the arteries what are going to form and make the circle of Willis. So students, do remember the circle of Willis. Now beginning with the topic, the circle of Willis, it is mostly found in the subarachnoid space. So students, do remember the subarachnoid space is the site where the circle of Willis is found. Now, to looking at the circle of Willis, I'll be focusing upon there are basically the blood supply to the brain. The first and the foremost thing what we should remember in this, it is that the blood supply to particularly the brain, it is mostly by the help of the two systems, that is first is the vertebral basilar system, which is also called as the posterior system, and the next is the carotid system, which is also called as the anterior system. So students, do remember the blood supply to the brain, it is mostly supplied by two systems. One is the vertebral basilar system and the next is the carotid system. So the carotid system, since it is supplying the anterior portion of the brain, it is called as the anterior system also, and since the vertebral basilar system is supplying the posterior part of the brain, it is called as the posterior system as well. So students, beginning with as to what is actually the circle of Willis. So before getting into the schematic diagram, I would like to emphasize the origin as to how the circle of Willis is formed. So students, we are going to begin with the heart. That is from the heart, how the branches are different branches of the blood vessels what are arising from the heart, and we'll be looking as to how they are continuing to form the circle of Willis. So students, do remember this is the arch of aorta. So this is the diagram what I have drawn about the heart, and since you have seen that this is the arch of aorta and this arch of aorta is going to have two branches. One is the brachiocephalic trunk, and the next the brachiocephalic trunk is there, and from the arch of aorta there arises the left common carotid artery and the left subclavian artery, whereas in case of the right subclavian artery and the right common carotid artery, they are the branches of the brachiocephalic trunk. So students, do remember the arch of aorta is having basically three branches. One is the brachiocephalic trunk, the next is the left subclavian artery, and the next is the left common carotid artery. So students, this brachiocephalic trunk is going to give rise to two branches. One is the right subclavian artery and the next is the right common carotid artery. So this common carotid artery is going to form a sinus which is called as the carotid sinus, and from this carotid sinus the branches what are arising is the internal carotid artery on the medial aspect and the external carotid artery on the lateral aspect. Now students, do remember the circle of Willis, it is basically arising from the left vertebral artery. So the left vertebral artery, the right and the left vertebral artery, they are going, which the left and the right vertebral artery, they are actually the branches of the subclavian artery. So students, do remember the left subclavian artery, this is the diagram what I have drawn. So this is the left subclavian artery, and from the left subclavian artery the left vertebral artery is going to arise. Similarly here from the right subclavian artery, it is the right vertebral artery what is going to arise. So the right and the left vertebral artery, which are the branches of the subclavian artery, they are going to originate and they are going to run medially. So after moving medially, they are going to join at the pontomedullary junction in the region of the brainstem. So students, do remember, at the level of the pontomedullary junction of the brainstem, the right and the left vertebral artery are going to join to form the basilar artery. Now, this basilar artery is going to bifurcate. This basilar artery is going to bifurcate to give rise to a circle-like structure, which is very commonly called as the, which is very widely, very famously called as the circle of Willis. Now, so this basilar artery is going to